channel. This is Dr. Jamil as usual. Thanks you very much for the subscriptions. For those who subscribe, if you are not yet subscribed, please subscribe to the channel, put on a notification, and we continue to learn, continue to live a disease-free life. Today we are going to talk about hernias and what causes them, how do we treat them. Some local healers have been taking it for granted. They give people local drugs to take. They give people a lot of drugs to drink in the name of healing these hernias, which is not true. Today we are going to see the common types of hernias, what causes them, who are the risk factors, and how do we treat the hernias. To start with, different categories of hernias, they are named according to the location where the hernia is formed. And what is the hernia in the first place? So, a herniation just simply means when part of your gut, part of your intestines, pass through a weak spot in your stomach lining, what we call the abdominal wall. You are having the abdominal wall like this. When you get a weak spot, for example here, part of the intestines inside, the small intestines, will escape and pass through this opening here like this. And what is going to happen on the outside skin, it's going to form a bulb. That's what we call a herniation. They have several types depending on the site where it is formed. One, we can have what we call an inguinal hernia. So another one, we said a femoral hernia, and we are going to look at each and every hernia and what it signifies. We can have an umbilical hernia. We can have what we call an epigastric hernia. Starting with the inguinal hernia, we saw in your pelvic region, your pelvis. We saw the anatomy of the pelvis in the first videos up there. You're going to come check that video. The pelvis has a ligament, and this ligament is coming from the when the pelvis is here like this. So this ligament is coming from the crest, iliac crest, coming to the pubis, what we call the inguinal ligament. So this hernia is going to pass through that ligament, getting its name as the inguinal hernia. So it passes below. So for femoral hernia, we have a canal here. When you look at your thigh, inside your thigh, just beside your genitals, we have a canal, and it is triangular in shape like this, starting from the inguinal ligament coming down like this. So this hernia is going to pass through this triangle, and it has a canal. So this canal is where these intestines, or part of the gut, is going to run through from the stomach, to run through and come into your thigh. So you'll be seeing something bulging besides your thigh, besides your genital parts. This one is called a femoral hernia. To differentiate it from an inguinal hernia, the inguinal hernia is just a suprapubic or above your genitals. For men, it can go into the scrotum. For femoral, so another type of hernia, and which is common in babies, it is what we call an umbilical hernia, just above the umbilicus. You see the baby has a swelling, and it can come in infants and young children. It's not common in elderly people. The femoral is common in ladies, and the inguinal is common in men, because they work and they do, and it can extend into their testicles below the scrotum. You see the testicles big like this. Now, for the umbilical hernia, it's also there is a weak spot just behind the umbilicus. Then these intestines will be bulging and entering that weak spot to form a bulge in the stomach. You see the baby having something big above their umbilicus. Then we have a epigastric hernia just here. In the epigastric, you see something which is bulging like this in the epigastric region. When dry enough, that I'm having a hernia? How do I know that I'm having a hernia? One, these things, normally the hernias, it comes and it disappears. You get a bulge and it disappears with time. You get a bulge and disappears. Until when you get what we call an occluded hernia, it comes and persists. And it's very painful. So the only treatment for hernias is what we call herniorrhaphy surgery. We come, we cut the skin, we open the skin, and we close this defect. We first push the intestines back into the stomach, then we close the defect. So that is the only treatment that can cure hernias. Leave alone the herbal medicine they give you, leave alone every propaganda they tell you about hernias. Nothing can heal them, only surgery.